Okay, I think we'll make a start. Good afternoon, everyone, or good morning, depending on where you're located around the world. I can see some familiar names in the attendee list. I know not everyone is not everyone is in the afternoon at the moment. So welcome to today's webinar, and thank you for joining. As you can see from the title, the topic of discussion is going to be reaching the unreached. Seeking to answer this question, when faced with limited resources and an unreached population, how do you optimize the location of new sites for services for maximum benefit? So we are effectively presenting Flowminder's approach to solving location allocation problems, and how we can reach people who are typically marginalized by perhaps existing healthcare infrastructure, education infrastructure, or other types of public services. So we'll get into that with a range of case studies and examples in the content of the presentation. So next slide, please. Yeah. So this is the outline for the session today. So firstly, I'm going to introduce Flowminder, and I'll also give my co-presenter Gemma a chance to introduce herself. And then we're going to move on to discussing the types of site location problems that we can help answer. And we'll be also asking you for some ideas of the types of problems that you're facing as well, and the sorts of things that you're interested in. We have, I know we have people from different sectors and people with different who are facing different challenges on the call. And then we'll detail our approach and do that via the means of some interactive exercises that you'll be able to participate in, before explaining a few of our existing case studies and previous work, previous successes using this approach, and then give an overview of how we might work together, possible collaborations for solving or addressing your location problems. And then there should be around 10 to 15 minutes at the end for a Q&A, but the chat is also open. So please submit questions as we're going along. We may be able to address them in the presentation, or we also have people on hand to write in the chat as well. So next slide, please, Gemma. So just to introduce ourselves first, the speakers for today. So my name's Alistair Stewart. I'm a spatial data analyst at Flowminder. I've been with the organization for around 4 years, and the material that we're covering in today's session, this optimization approach, location allocation problems, this is really what I specialize in. So I've been involved in a lot of the use cases that we'll look at later. But I also turn my hand to various other spatial analysis problems as well. So thanks for allowing me to introduce myself. I'll just give the floor to Gemma to say a few words as well.
Yeah, hello everyone. It's really great that you've been able to join us today, and hopefully you're going to find this next hour useful. We'll get you thinking a little bit as we go along, and so please do, as Alistair said, put questions as we go into the question box. And I'm Gemma Davis. I joined Flowminder last year as a geospatial solutions developer, and I've been working closely with Alistair on a lot of this spatial analysis work, including our most recent case study, which you'll hear about a little bit later. And that I'll hand back to Alice, who's just going to explain a little bit more of who Flowminder is.
Thanks. So next slide, please. Yeah, so we've got a short video here, so let's just watch that for a minute or so. Thanks. So just to add a bit more detail to what you saw in the video there. For those who aren't aware, we are a non-profit organization registered in Sweden. Um, we've been around for about 15 years. So we began in 2010 as part of the response to the Haiti earthquake. Um, so yes, quite a few years of experience under our belts, and we specialize basically in big data analytics for good. So seeking to leverage big data to help those most in need. And at the moment, we consist of around 30 staff and consultants in various different countries around the world. Next slide, please. Um, and then in terms of our core services, as you saw from the video, we carry out a lot of work with mobile data, so looking at population mobility derived from data coming from mobile data partnerships. That's not going to be a focus of today's presentation. But if you would like to know more about that, then of course do reach out, and we'd be happy to talk in greater detail on that work stream. So what we're focusing on today is this kind of third pillar really here, the geospatial data analysis and site placement optimization. So once we have population data, where can we place new sites to best serve that population? And we also are engaged in capacity strengthening. So this is a feature of most of our project work. Obviously, upskilling end users so that they can get the most from our data and from our analysis as well. Next slide, please. So I'm now going to hand over to Gemma for a section introducing the site optimization. Thanks.
Okay, so we're talking a little bit here about site optimization, which seems like a fancy term, but I want you to just stop and pause before we get into anything more detailed in terms of our approach, and just think what we mean by site. So even in our title, we said it was about optimizing locations of new sites, but new sites for what, and what does a new site look like? So in a minute, I'm going to get you all involved in actually thinking about some ideas as to what some of these sites might be. But to give a bit of context to that, we're thinking about any kind of new facility that might need to be built or permanently located. But it might equally be a service that can use an existing building or structure. So it doesn't have to be something so permanent. It can use an existing room or existing community building, perhaps. Or it may even be some sort of temporary service or distribution point that only needs a location. So somewhere where you're just going to put a table out or a stall, maybe a tent. So as we go into this next step, think about that. Don't limit yourself to something that has to be permanent or physical structure. Think just about any site that needs to be placed relative to the population to meet that need. And this is where we're going to ask you to do a little bit of thinking here. So if your phone is to hand, you might want to use your phone and just scan the QR code to join this. Or you can go to slido.com and then enter the number that's on the screen here, which is 2661 650. And it should ask you then to enter some possible sites. So you think of any examples you want, anything that you might want to place in space. So I'll give you a couple of suggestions to start off with. So it might be a vaccination site, it might be a school, anything like that. Don't feel you have to be restricted just to your work context. There might be any other context you think this is useful in as well. So if you can start adding those now, what we're going to do is build up hopefully a bit of a word cloud. And don't worry if somebody else has already entered what you were thinking of, that's fine too. Word clouds work well as to putting those together. Great, some good ideas coming through. We'll just give that another few seconds if anyone wants to add anything else, and then I'll move on to the next section. It's interesting seeing what's coming through. Some of these are things that we've actually worked with before. Some of them are things that we've not necessarily had examples with, but are really good examples of what we might do in the future. We'll hopefully support you with. I can see somebody else is still typing, so I'll wait to see if one more comes through before we move on. Excellent. So now I'm going to think, with those examples in mind, what are the kind of questions that we can help you answer? So we can support you with the following kinds of questions. Let's pick vaccination site, because that came through in a couple of examples there. So we might ask a question that is, what are the optimal site locations for vaccination sites that will reach the maximum number of people with the resources I have available? But you could equally substitute into that warehouses or resource centres or any of the other ideas that you had there. Or you might phrase these questions slightly differently. So it might be, how do I locate sites for vaccination sites to ensure everyone is reached within a particular distance threshold? So that might be 5 kilometres or something like that. And then we can help iterate through that and think, well, what happens if I change that distance threshold? And I assume people will maybe travel 10 kilometres or just 2 kilometres. And we can easily rerun that analysis and see how many sites you would need. We can also help answer questions like, what is the limit to the percentage of the population I can reach with the resources I have available? So we know that resources are often a real constraint, and sometimes you need to flip that question that way around. So before I move on, I would just encourage you all to maybe look at those questions there and think of your own example of what kind of site you might be interested in placing. I think, what is the question that you would ideally like to ask? It doesn't have to be what I've got written here. Think about what is the question in your case that you would love us to be able to help you answer. And maybe even encourage you to write that down so that you can think about that and come back to that as we talk through some of this method. And that will hopefully help you prompt what questions you might have at the end for us. So why do we do this at all? So the main motivation is reaching unreached population. So the approach that we've got is really good at identifying the population that are already well served by a service and identifying the population that have been missed, and then prioritising placing sites to reach them. It's also really good at helping you distribute limited resources. So whilst it might be great, back to the example of vaccination sites, to place sites within 5 kilometres of an entire population, we realise that at some point there's going to be somebody on a rural farm who's almost 5 kilometres from the next person, and it's not realistic necessarily to place a site for everybody, and you wouldn't have the resources to put all the sites in place. So we can help you distribute the resources by putting some prioritisation in place. Our data inputs for this are actually really straightforward. So one of the advantages of the approach is it's not complicated in terms of lots of variables, although we can add that complexity if we have the data and if there's a reason for it. But essentially we use something called gridded population data, which you can see the example on the left-hand side of the screen here. where each 100 by 100 meter pixel is given a population estimate. And there are lots of organisations who already produce these kind of estimates. We typically work with an organisation called WorldPop, and we can add into that other layers of data like migration to refine that. We can also pull out of that particular subsets of the population. So it might be, if it's childhood vaccinations, we only want to know where the population of a certain age is, or if it's health services for women, it might be that we just want to pull out the women. Or if it's digging a well somewhere, then it might just be the whole population you're interested in. The other two variables we then need are any existing sites. So if you're adding sites to an already existing set of services, we need to know where the existing ones are, so we know which population is reached and can then define the unreached. And then simply a boundary of the area you're working with. So we might work at a whole country scale, we might just work at a local district or regional scale. So we're going to play almost a little bit of a game. I think maybe calling it a game is an exaggeration, but we want to get you thinking at this point. And I think a few people did sign up off the back of Humanitarian Partnership and Network Week last week, and you will have probably seen the board game version of this, so you'll have an idea what we're doing. But to explain, in this example, we've got a fixed health site, which is the red cross more or less in the middle of the screen. And we're showing here a 5 kilometre service area around that, which is the green circle. Then in the little grey squares with the numbers, this is simulating our population data. So we're assuming each of those numbers is 100 people, represents how many 100 people. And what we want you to do now is to think about where you would potentially place an additional site. So the rules for this are that it needs to be reached from the current site. So think about whether you would be able to get over that river without a bridge. And then think about the population. Where is there a good clustering of population that might be a good new site location? And I'll just give you a minute to think about that. Think about what grid square that might go in. And then I'll give you a couple of options to what I think might work. And this hopefully illustrates just a little bit of the data inputs that we're using. So I'm now going to show you two of the possible locations I think might work here. I've eliminated that big cluster of population at the top left because it's a bit too far away when there's no crossing across the river. And then it depends on your approach. I think the option I show at the bottom here has a bigger population within a particular area, but it is a little bit further from the main site in terms of travel distance. And there's also a significant amount of population within 5 kilometres of the other site. So the reality of the decision making that you will make is it's not just about what priority or rank order we would give you data in. There's lots of other logistics on the ground that you might want to factor in. Now I'm going to zoom out a little and give you a different scenario. So now there are 2 fixed sites already with their 5 kilometre circles around them. But you can see there's a lot more population. And if you had miraculous eyesight, you could probably still read the numbers in those squares. But I'm assuming most of you can't. And if I was to now say place 10 new sites that can be reached from those existing sites, I'm guessing it would start to make your brains hurt a little bit. Feel free to have a try while I'm talking. And can you imagine now if we rolled out to the whole country and we wanted to place sites that would reach all of the population and then put them into some sort of order of priority in terms of population reached? You'd realise quite quickly you can't rely on a manual approach to do this. And this is effectively the tool that we have that can help you with that planning. It will create all of the sites that you need to reach all of the population and then rank them in order. So again, just a reminder, as we're thinking through this, think what your questions are coming out of this. What's it making you think of in terms of what might be useful? What questions is it adding in your mind as to what is feasible? I think I've already touched a little bit on this, but our approach is really fast and flexible. And what we mean by that is we can change the number of sites that we want to place or the percentage population to be covered. We can change distance thresholds. We can add new existing sites in, and we can rerun it really quickly. The example that's just illustrating here on the left-hand side at the moment is placing vaccination sites in Nigeria. And it's not showing you all of the sites that we would have generated, but it's showing you the ones that were selected within a given threshold and being placed in rank order. So we place first the site that reaches the biggest number of currently unreached people, and then the next site, and so on. And all of this can help you with some strategic decision making. As you increase the size of a service area and the distance threshold that you're going to apply, you'll see obviously you need less sites. I think that's relatively intuitive. But you also see, if you look at this graph, that the first few sites you place give you big gains potentially in terms of population reach. And at some point, you will then reach a point where every new site gives you a relatively small gain and you potentially need lots and lots of sites. And these graphs that we can help produce help you with that decision making. You know, what is the population gain relative to the next new site that I might add? And how does that relate to the resource constraints that I have? And then for outputs, we can give you a combination of outputs depending on what is most useful for you. So we can give you conventional printed maps. We've often produced big A1 maps with sites marked on them, or digital maps that you can zoom in on, or online interactive dashboards. And we have an example of that if anyone wants to see it. Or just data tables, you know, site locations with their coordinates, with the population served. And typically these would complement the other data and outputs we give you. Hopefully that gives you a bit of context as to how this all works. And then Alistair's now going to bring that to life with some applications. Thank you.
Thanks, Gemma. Yeah, so as we can see from the map here, these are the countries where Flowminder has provided optimization services, and the types of project that we have engaged with in those countries. Yeah, one of the things we're keen to stress here is that the approach is generic, so it's not constrained to one particular sector or type of resource. But we have kind of skewed historically towards the healthcare vaccination space, just because that's very much a kind of in demand thing in these countries that we're looking at. So you can see there's several examples of different vaccination sites for COVID, measles, and routine immunization. But we've also got examples of work in the education sector, so primary schools, radio transmitters, and also as someone actually suggested on the word cloud, we have carried out some work placing mobile money agents in Tanzania as well. So I'm going to explain 3 of these use cases in more detail, and then we'll also quickly look at some other ones as well. Next slide, please. So the first one I'd like to discuss is a recent work in the Gavi Reach project, vaccinating zero-dose children in the Horn of Africa. So the idea of this work was as part of a consortium to target zero-dose and partially immunized children in hard-to-reach, in crisis areas of Ethiopia, Somalia, South Sudan, and Sudan. So the project was working in areas outside of government control, or where there's limited government control and vaccination programs. Potentially conflict, potentially displaced people, also environmental or climate-driven access issues such as flooding. And in fact, I saw in the chat someone from South Sudan was mentioning how much of an issue that is for delivering vaccination services in that country. So yeah, there's a wide range of access challenges, um, as well as the kind of usual issues of identifying the target population and recommending new vaccination sites. So the question here we were seeking to answer is, where are the best places for partners to expand services? So they're already engaged in services in target areas, but where are the best places for them to expand those services using mobile or outreach vaccination sites in a safe, sustainable way? So they need to be able to reliably go to those mobile and outreach locations, and they need to be in places where there's zero dose or partially immunized children, i.e., target beneficiaries. So next slide, please. So this is an example of the work in Somalia, looking at one fixed site in particular. So the map on the right is centered on a site called Bulajimak Health Center in the city of Baidoa. Um, and this is yeah, a very challenging environment. There's uh, lots of kind of militant activity, displaced people, and particularly affecting the villages and settlements around the city. And using our optimization tool, we were able to recommend several potential locations for mobile sites. And then our partner on the ground, Rado, who are carrying out the vaccinations, approved two of those sites for use, which we can see the ones the arrows are pointing at, and then go to those sites and carry out vaccination. And yeah, this is a kind of hyper local example. So we're looking at obviously one fixed site here, but we've given similar recommendations for expansion around 300 or over 300 fixed sites. So kind of an equivalent process of suggesting sites and then reviewing them with the partner. And when it comes to that question on flooding, so the approach we have taken there at the moment is the partner on the ground would approve or reject sites based on the access challenge if there is flooding happening. But we can also add flood extent data into our methods, and to ensure that we're not placing sites in a place which is likely to be flooded, or if we are maybe in the dry season, we're placing sites in those places, but then we are aware that that those sites may not be accessible for 12 months of the year. So yeah, lots of you can see here how we've gone from that kind of generic approach that Gemma presented to immediately into like the messy reality of applying the data on the ground. So next slide, please. And this is yeah, kind of highlighting that we have a microplan support map in place at the fixed site in Baidoa in Somalia. So the team were able to refer to this map for planning their activities and going to those new sites, among other kind of more routine navigational yeah, applications as well. Next slide, please. And yeah, the mobile vaccinations are in progress at those sites. So this is an image showing yeah, showing that happening. And we heard from the partner that in fact this village had not been visited by vaccinators in more than a decade. So although it's geographically, as we saw on the map on the first slide, although geographically it's very close to the fixed site, so I think maybe 10 kilometers away, something like this. The nature of the kind of the conflicts on the ground and tensions on the ground meant people thought that the village had been emptied of people and hadn't been going there for vaccination. But through our analysis, we were able to restore those vaccinations, and they're continuing to be active there. Next slide, please. Okay, so going from kind of one extreme to another. So just then we were looking at obviously a very close example, just two mobile sites around one fixed vaccination site. Although we did apply that, as I said, across project countries, we were kind of looking at the details there of that unique context around Baidoa. But at the other end of the spectrum, we also supported COVID-19 vaccination at a national scale. So we're able, through this method, as you saw from the game, we can carry out recommended placement for really large geographic areas very quickly. So we modeled the sites for Nigeria, Zambia, and Burkina Faso. And this totaled over 110,000 locations for new sites that were recommended in those countries. So quite a substantial amount of new locations for people to carry out COVID-19 vaccination. And yeah, obviously like a job which if you were doing that kind of manually as we were trying to earlier in the game, very arduous trying to manually place those sites. So that's where the benefit of this analysis comes in, being able to do it at scale. Next slide, please. And here's some results from Adamawa State in Nigeria. So our results were in Nigeria. Our results were given to each state. They have a lot of autonomy over how they were carrying out their COVID-19 campaigns, and we got data back from some of them, including this one. And we can see here, this is a graph which shows daily delivery of the vaccinations. So on the x-axis we have the days, and then the y-axis is number of vaccines delivered. And we can see for the first kind of 45 to 50 days, delivery rates were fluctuating around the 2000 mark. And then our suggested sites were handed to the vaccinators, or they were actually put on a dashboard which the vaccinators had access to. And then there was a big uptick in delivery, going up to around 5,000 a day once those planners and teams had access to our results and were able to be precise in their planning and targeting of where to go. And the troughs on the graph are, as the label said, they were weekends and holidays. So from kind of day 50, day 65 onwards, we have this very stable pattern due to those suggested locations. Thanks. Next slide. Yeah. Okay. So we talked about vaccination use cases, but as I said at the start of this section, we've applied the approach to some other types of services. One of which is in fact radio transmitters in Sierra Leone. So in that country, FM radio is used for distance learning by school students during pandemics. So this initiative had its origins in the response to the Ebola crisis there, and then it was reused during COVID as well. And we had a request from David Senge, who at that time was the Minister of Basic and Senior Secondary Education. And he wanted to know where are the most effective locations for new transmitters to expand coverage. So I think at this point him and the ministry had some idea that the coverage was not uniform across the country, and they wanted to know where new transmitters could be placed to achieve that. Next slide, please. Yeah, so the first thing we did, and this is what we do in all of our use cases, is we assess the initial coverage of existing services. So in this case, because it's radio transmitters, we used a radio propagation model, which is why we have this kind of fragmented service areas around each of the maroon dots, which are a transmitter. So there's 9 in total existing transmitters. And around 66% of children in Sierra Leone live within estimated range of those transmitters. And if you're wondering why the one on the far left has a much bigger service area, that's because it's a much more powerful transmitter. But you can see how the signal's kind of disrupted by elevation and other things that block radio waves. And clearly, there's parts of the country where signal was non-existent. So next slide, please. And then, yeah, here's the placement of new transmitters. And this was using a fairly kind of conservative range, I think 40-kilometer signal range. Obviously, there's a lot of variables when it comes to radio transmitters. So we sort of erred on the side of caution here. And we made this 100% coverage model, which is again always a feature of our analysis. We always initially produce a 100% coverage scenario, and then we subset those results. So you can see the yellow, orange, and red dots are all the new transmitters. With the grey color is their service areas. And then if we were to build 3 transmitters, which was stipulated by David Senge, Minister David Senge, and his colleagues. If we were to build the 3 best ones, coverage would be increased to around 78%, and those are the ones which are circled in the blue circles on the map. So we're able to, like I said, provided a 100% coverage scenario, and then discuss with the end user who had limited resources for new transmitters, which are the best ones to place to get the most value for money and get the most people within FM signal. Thanks. Next slide. Okay, so I'll just spend 1-2 more minutes talking about some of our other use cases. So the first one on the left here is our mobile money agents. This was actually the first use case that we applied this method to in Tanzania and Bangladesh. So trying to kind of have a more equitable access for population to those mobile money agents who tended to cluster in urban areas at the expense of potential customers in rural areas. So yeah, we were able to present maps and data to organisations engaged in mobile money to make those recommendations. And then on the right, another education use case. So this is schools in Nigeria. So primary schools, recommending new locations for primary schools. We produced results for the entire country, and then these were also presented on a dashboard. So different people from different states and at different levels in the ministry or the Universal Basic Education Commission were able to look at those results and interact with them. Next slides. And then two examples from Democratic Republic of the Congo. So first on the left, this is actually an ongoing use case. These are also vaccination sites for routine immunization, outreach vaccination sites, so expanding existing services. The exciting thing about this use case is we've integrated travel time to our service areas. So we can see on the map there the kind of the service area shapes are irregular rather than circular. That's because they reflect the walking time to that to the sites in the middle of the service areas. Um, so yeah, we're still engaged in that work and looking forward to seeing results as data gets into use in around 11 provinces in DRC. And then on the right, these were community care sites in one province in Kasai in DRC. So looking at supplementing primary healthcare with community care sites and also presenting those on support maps so that healthcare workers were able to plan and visit the new locations. I've got loads more to explain and talk about with all of these use cases, but obviously we only have another quarter of an hour, so I'll hand back over to Gemma and look forward to coming back for questions at the end. Thanks.
Thanks, Alistair. Now, I'm actually going to suggest that these next couple of slides we're going to do slightly differently, because I realised earlier I think a lot of you are having problems accessing Slido, maybe because you're joining the call from your mobile phone, which is totally understandable. But I still want us to stop and think about these questions. And you can perhaps, if you're happy to share your answers, pop them in the chat. If you'd rather not share your answers publicly, then perhaps just think about them yourself or make a note of them. And if there is something you want to pursue with us later, you can pick that up. But stop and think about, what do you see as the potential benefits of this solution for your work? So we thought a little bit about the beginning of, what sites would you want to locate and what might your questions be? Can you see a potential benefit of this for the work you're doing? And if you can I just encourage you to share that in the chat if possible. But if not, just concentrate on what you think it might be for yourself. And then whilst you're also thinking about that, it goes hand in hand with my next question, which is, what do you see the challenges of using this for your work? Maybe you really like the idea, but you're not quite so sure that it would actually work, or that you've got a concern or constraint that you're thinking about. And again, if you're happy to, please do pop that in the chat. But otherwise, just think about what that constraint might be. You can maybe also phrase that in the questions and answers later. Great. So please do continue adding that. I'm going to go, conscious of time and wanting to leave a little bit of time for questions and answers at the end. I'm just going to go next into a little section where we explain actually what it looks like to partner with us. So if you've got to this point, you're thinking, actually, I can see some potential here, I've got a few questions, I'm not quite sure it would work because of this, then we'd love to talk to you further. We can answer questions by email, we can set up a one-to-one call, that's absolutely fine. Brilliant, some people actually answering through Slido here as well, so I think a couple more people typing. I'll just leave a minute to capture those answers. And actually, Sophie, some of these questions are actually quite interesting, so if you're able to capture any of the question there about privacy issues, maybe that's one we can pick up in the Q&A section. That would be great. Just let this one last answer that's appearing come through, and then I'll move on to the next slide. Okay, great. So what I want to say here is every project is bespoke. There's not a simple formula. It doesn't always look the same. We might work with one partner and they've got really great input data. They've already got all their existing sites. They know exactly what their question is. We go away, run our tool, give them some answers. They maybe ask for a slightly different scenario. We might rerun that, but it's very limited. We produce some data, hand it back. Or it could be like the most recent project we've worked on that Alistair talked about in the Horn of Africa, where it's a journey with a partner or set of partners over a number of years, including workshops and training and helping prepare and clean data. So the not only is the kind of site you're locating very different in each scenario, but the extent of support that you would want from us might vary considerably. So the next step, if you are interested and this has sparked something, and you might want to come back and have a follow-up meeting quite soon, or it might be that actually now it's not relevant and in a year's time, it comes through as something you think about. But you would get in touch with us, and then what we would do is scope that concept and that project and what it looks like and what you would benefit from us together. And then we would look for funding. So most of our work is grant funded. Great if you've got a pot of money that you can pay for services from, but we're not expecting that to be the case for most people. So it is a case that we would scope the need and then we would collaboratively look to find the right funding for that. And if you are interested and you want to have follow-up conversation at any point, if you make a note of this email address, so it's optimisation@flowminder.org. And if you don't get a chance to copy that down now, don't worry, because it will be on our final slide. And I think Sophie hopefully can also copy that into the chat for you, so it's a bit easier. We will also send out a little follow-up email after the session with all those details. So at that point, we're going to go into question and answer session now. We've got 10 minutes remaining. If there are more questions, we can also stay on a little bit later if people have time. There is, I think, a question and answer button, so please feel free to click on that and add your questions. If you can't find that question and answer box, as Sophie's already said in the chat, please just put your question in the chat and we can move it across and answer it. That's not a problem, as long as we can capture it. So yeah, so thank you very much for listening, and hopefully we'll be able to address some of your questions. Alistair, are there any other questions that you've got an answer to? Otherwise, I'll start having a look at them myself.
Yeah, I can have a go at the privacy issues one, which has come up. That's a really good question actually, and something that as data users we should always be conscious of. I think in terms of the projects that we're running, it doesn't tend to be a big issue, although it is something that yeah we do think about actively. So we're not using personal data in any way. We tend to rely on population estimates, which you know, as Gemma said, are coming from sources like WorldPop, perhaps are augmented with other sources like IOM or something like this. So we're not looking at kind of individuals' addresses, individual names, locations, things like that. In fact, the data is yeah usually an estimate, so that comes with other issues, but generally not ones regarding privacy. And then when it comes to the services themselves, so usually these as we've explained, usually these are public services that we want people to know about and we want people to access. So we're typically working with existing site data, so maybe vaccination sites or schools, these kinds of things. And usually that data comes from the end user or is maybe sourced from somewhere like Humanitarian Data Exchange. And yeah, those are places where in general we want we want people to know where they are and to be able to go to them. So it's not really a concern regarding privacy. And then the again with our recommended sites, it's kind of the same dynamic. There are sometimes security issues, and so you know like the example from Somalia, we're working there in an area where there's uh yeah different types of security challenges. In that respect, we work closely with our with our partner on the ground and take their advice on how things should be presented and so on. But yeah, in general, we haven't really come up against these types of privacy issues. Potentially, there are types of service where that could be an issue. And if the person who asked that question has their own thoughts, then do add more comments and we can get into those details as well. But yeah. In general, it's not a big issue. Thanks.
Great. Perhaps I'll try and answer the next question, which is here, which is how long does it take to run such projects and collaborations? And Alistair, feel free to jump in with any clarifications if I don't quite capture this correctly. I think the answer is it depends hugely on what you actually need from us. So if we've got simple data inputs, and as we said earlier, that can be population data that we can source quite easily, and then an existing set of sites. The analysis itself only takes really a few hours to run to get some outputs, very basic outputs. If you're wanting a beautifully created dashboard or maps, it might take us a little bit longer. But generally, we'll be working as part of a little bit of a bigger collaboration than that. So we'll have more understanding of what you need, and we'll go back and forth multiple times. This means if you only really need the basic outputs from us, it might just be a few days a week over a few weeks or a few months. But at the same time, it might be that actually you want us to help source the input data. So if you're working with mobile money lenders, for example, I think was one of the examples given earlier, and you don't have very good data on where they're already based, or you do have data, but the locations need a lot of tidying up. We might start by helping you prepare the data. Then we might run some analysis. You might come back to us and say, actually, what happens if we change the distance, or what happens if we take another factor into consideration? Can you come and run a workshop? Can you give us some training on some of your tools? So it can be much more substantial in some cases. So it can be anything from probably, a few days of work over a couple of months, for example, to, a multi-year collaborative project. And this is where really everybody's situation is bespoke. So if you're at all interested, please do sign up to have a follow-up conversation with us, and we can give you a much more bespoke answer to your particular area of interest and what suits you.
Thanks, Gemma. I'll pick up this question on what does a typical project look like? Where do we start? So yeah, another really good question. This again, there's probably some variation in how things might happen. But in general, if the person who asked that, I'm imagining is a potential end user or is working with potential end users and has this type of problem they would like to solve. The way to proceed would be, I think, first to have some one-on-one calls with us so that we can start to explore the problem and the type of geography, who we're working with, these kinds of things. And then perhaps put together a small document that we can then go and speak to donors and try and find some resources to fund the work. I think our experiences in general, we have, yeah, I mean, we've obviously carried out a few projects, so I think over 10 projects, and a lot of the major donors in the development humanitarian sector are very enthusiastic about these types of data-driven solutions. But often we're, not, they don't have the use cases themselves, so it's a case of coming to them with the use cases, and then if and when funding is secured, then we're able to start producing some initial results for discussion. So normally we have like an iterative approach where we would, yeah, probably generate some results quite quickly to talk through with you and your colleagues and the end users. And then we would seek to improve those results based on the feedback from the end users. So maybe changing inputs, adding, perhaps cleaning input data like Gemma said, and then also how the sites are being visualized and how they are how they're going to fit into the existing workflow. So with vaccination, for example, often people are not may not be used to working with spatial data or working with even maps, digitally produced maps. So we would need to have those kinds of conversations and perhaps run some trainings. And I see actually someone earlier said most of my staff are not well trained in this as a potential challenge, and that's definitely something we're very sensitive to. And we would want to integrate that into any project. So making time early on to introduce those staff to the approach and to working with this type of data, and often we're able to give them skills to make some of their own maps as well, because that's all part of handling this type of data. That's what happened. That's what's happened in the Reach project that I was talking about. So yeah, so that's the kind of general shape of how something might happen. But yeah, I think the first thing is just that initial conversation. So yeah, so do reach out so we can get the ball rolling if you have ideas. And niches that this approach can fill. Thanks.
So I'm really conscious that we are now at time, and there is one more question, and we're very happy to stay on and answer it, which is what are the greatest challenges you face in your projects? But please, if you've got other meetings and things you need to dash to, do not feel bad if you want to drop off the call at this point. And do reach out if you're interested in talking further or however the questions. I think, Alistair, I'm probably going to pass this question back to you as the person with more experience working on the projects. I'm guessing data inputs is one of the big ones in terms of how clean data is, but if you can maybe pick that one up.
Yeah, that's where my mind went to immediately as well, data inputs. So yeah, so as we've highlighted, we've deliberately designed this so that it only takes a few data inputs. So those gridded population layers, existing sites, and then the geographic boundary of the working area. But even with only those three data inputs, there can be lots of challenges sourcing good data or data that perhaps everyone in the project or all stakeholders are satisfied with. So, population estimates, as you can guess from the name, they come with kind of inherent uncertainty. And then with existing sites, this is normally something which is maybe more straightforward to solve, but can require some manual on the ground collection by partners, or using web maps to get coordinates. And then boundaries as well, that there can be kind of political sensitivities and things like this. So yeah, so that's one of the reasons why we take this iterative approach. Is normally for a first iteration we would use the best quality data that we can source as quickly as possible, with a view to improving those inputs with our with the partners on the project. Um, but having said that, some of you may have come across, not to get too much into the technicalities of GIS, but like there's other approaches to solving these problems, multi-criteria analysis, for example. and they tend to take like many more data inputs. So you have much greater uncertainty kind of with each data input, or much greater challenge potentially sourcing those inputs. And that's something that we've tried to mitigate, or at least like leave on the table as something we can add if we think we have like the flooding data earlier, for example. If there's a good layer for that, if there's good data for that, then that can be integrated. Otherwise, we can think of kind of more practical ways around it, like using local expertise on the ground to exclude or include suggested sites. So I think that's probably the main challenge that's common to all projects. But then within each project, there's obviously their own unique challenges. But yeah, I think that's probably the biggest one. Thanks. Were there any other questions? I see. Oh, hopefully we've ticked that we've answered all of the yeah, all of those questions in the Q&A box. And I see we've gone slightly over time. There's still a few people on, which is great. So I think yeah, just to say thanks for coming along again. Hopefully this was stimulating. Hopefully you've it's got you thinking. I appreciate we appreciate that it may be, you know, like these types of data and spatial analysis may be something quite new to you, or equally it might be something that you're very up to speed with. I mean, if either of those are the case, then we're happy to uh, you know, kind of go over what we've explained one on one, or get into more of the technical details with people who are already experts in GIS. And yeah, I'd like to encourage you to yeah, to reach out on that email address and have a think about your own situation, and whether there's types of use case, types of problem that this approach can be applied to. Um, yeah, so thanks from me. I'll just give Gemma the opportunity to say a few words as well, and then we can close.
Yeah, just to say thank you so much for your time today. I realise a lot of you have probably got very busy jobs. We hope you found it useful and interesting, and hopefully we'll hear from some of you and have some follow-up conversations at some point as well. But yeah, have a great rest of the day wherever you are. Thanks, everyone.